right, it's 10:31 on RB2 station of choice, and each and every Saturday around this time we get to talk to Dr. Bhagat, talking the Broken Body series. This is a segment in which we get to talk to Dr. Bhagat. Morning, doctor.
Morning, how are you?
Quite well, I hope you're well too.
I'm good. We're continuing our series on commonest causes of death globally, from which Botswana is no exception. And last week we talked about heart disease, and we sort of understood why heart disease is the leading cause of death in women and men. People think, breast cancer is more common than heart disease in women. It's not. Heart disease is far by its greatest killer in women, and breast cancer is way below that. So today we're going to be talking about, we're going to tease out amongst heart disease. So there's a huge collection of diseases. We're going to talk about blood pressure. Do you know anything about it?
I know blood pressure. I know high blood, low blood, yeah.
Yeah, well, that's a very common thing to answer. A lot of people confuse high blood and low blood with blood pressure, and people say, I've got high blood, I have got low blood. That generally, in doctors' language, talks about the blood circulation. So if you have a low blood basically means you're anemic and you've lost blood because you bled from somewhere, your stomach, or you've got a heavy period, or you've had surgery. That's low blood. But high blood pressure is actually pressure that is generated within the heart because of the tubes that go out of the heart. And I'm sure there are people with blood pressure in your family, right?
Yes, they are.
Yeah, I mean everybody has somebody who's got blood pressure or knows their pressures are high, and sometimes they don't take treatment because, one of the reasons why blood pressure is so common in terms of it causing death is that, it's uncommon to present with symptoms. If I asked you, what do you think people present with when they have blood pressure? Tell me.
What do I think people present with?
Yeah, what do they complain to the doctor about? How do they know if they have blood pressure?
I think maybe, I don't know. Well, I'll say for me, because recently I went to the doctor and the doctor saying your BP is a bit high. I had too much headache, like my headache was not stopping, and I don't know, my heart was beating a bit faster than normal.
Yeah. So that's the greatest misconception that, we'll tackle what you said in two parts. One is, say, for example, you have a headache. Now, because you're in pain, the blood pressure will go up. It doesn't mean you have blood pressure. It means you have a headache. If somebody bangs your car, you get upset, and then you have to go to the doctor for something else, let's say flu, and your blood pressure is high. Your blood pressure is high not because you have hypertension or high blood pressure. It's because somebody banged your car. So it's really important to make sure when somebody, a nurse or a doctor or a clinic or a hospital says, you have blood pressure, or, BP or udimu, you have to look at the context in which that blood pressure is high. Did something stress you? Are you taking medication? Flu medication can raise your blood pressure. Painkillers like Brufen and Comprel and the now banned Grandpa are famous or infamous for raising blood pressure. So make sure that pressure is truly high, not because you've had an accident or somebody's upset you or, your boss has shouted at you, but because you're in a calm environment, you've checked that blood pressure a number of times, and it is higher than normal. Now, normal blood pressure is 120 by 80. What does that mean? It means the pressure, when the heart squeezes blood out of the circulation, that we give that a pressure measurement in millimeters mercury, and that's 120. When the heart chills out and relaxes to receive the next pint of blood coming from the body, that's the state of relaxation, and it still has some pressure, and that number should be not more than 80. Now, in the old days, we used to say, as you get older, your blood pressure is allowed to rise, and unfortunately, some people out there still feel, I'm getting old, Naka, so it doesn't matter if my pressure is a little bit high. We know it matters that, whether you're 18 or 80 years of age, your blood pressure should be less than 120 by 80. Have you measured your blood pressure recently?
Last I measured was on Tuesday.
Yeah, well, good. I think everybody should check their blood pressure over the age of 18, and at least once a year. If it's okay at the age of 18, check it annually. Also, over the age of 30, you'll notice whenever you go to the clinic or the hospital, for whatever condition, it's not necessarily for checking your blood pressure, the nurse or the doctor will first check your blood pressure irrespective of what your complaints are, because that's what we teach our students, measure the blood pressure, because hypertension or high blood pressure really is silent. It really is a silent killer. It is a condition which doesn't present with headache or dizziness or chest pain or shortness of breath until the very end. So it's really important for people to understand the only way to check whether your blood pressure is high is to have it checked by a nurse or a doctor. And when you have it checked, make sure you are chilled out, you're relaxed, and the nurse or doctor measures it at least once or twice. And make sure that the machine is calibrated. Too often I see, on TV and others, people, the nurse holding the cuff when they're measuring the blood pressure. If the cuff doesn't fit and you put pressure on the cuff, the pressure is going to be high because you put your hands on the cuff to hold the cuff. If you're skinny and that cuff is too loose and you have to tighten it several times, you're going to get the wrong measurement, and then of course, I'm just like, checking your car or making sure you've got antiviral software in your computer. You've got to make sure these machines are calibrated, otherwise they give you the wrong measurement. And remember, even in 2023, unfortunately, hypertension is incurable. There is no cure for blood pressure today, and certainly in my lifetime, and I'm an old man, I can tell you, I don't see it coming in the near future. What we can do is we can control it, and we can manage it, but we cannot cure it. So people who have a label of hypertension need to make sure that label is correct. And unfortunately, do you have friends who have blood pressure that are on treatment?
Doctor, can I ask something? Oh, okay. We get that high blood, it's a silent killer, what? But what are the causes of it? I just want to get that.
That's a really good question, and the answer to that is, unfortunately, we don't know. But what we do understand and appreciate is that when people become urbanized, in other words, when they move closer to a city, lots of things happen, and there's some very beautiful studies coming out of Kenya and even Brazil, where in Kenya, where the Maasai tribe moved closer and closer from Kisumu, which is outside Nairobi, into Nairobi, the blood pressure rose. And when the Amazonian Indians in the rainforest in Brazil moved to Sao Paulo or Rio de Janeiro, the capitals of that country, the blood pressure went up. So something is happening as you move closer to a city. And what happens? Well, we all know, we tend to sit more. We tend to eat a lot of rubbish. We tend to eat processed food, starchy food, sugary food, salty food, excess oily food. And of course, we're not moving about out. You sit and like you and me, were sitting on the radio and sitting in our chairs. And so, as a result, we become overweight. We don't exercise. We eat the wrong foods. We salt load with lots of stuff. And as a result, we think urbanization is one of the biggest issues to do with blood pressure. Of course, it's important to understand that that's not the only cause. And I had asked you the question, do you know somebody of your age who has blood pressure? And I'm sure you do have friends who are actually hypertensive on treatment at your age, and that's the thing that we're finding, unfortunately, is that it's occurring at a younger and younger age. So people, even at the age of 18, were picking up blood pressure. So it really is something that everybody needs to listen into in terms of hypertension. Do you have anybody who's suffered consequences or complications in your family from blood pressure?
No.
Well, we're going to talk about this next week. One of the complications of blood pressure is stroke. And, everybody has somebody, a granny or an aunt or a grandfather or somebody has suddenly died of a stroke. And this is the consequence of untreated blood pressure. And because it's silent, people say, Baka, you've given me this pill and you're measuring the pressure and you're telling me it's better, but I don't feel any different. And that's the temptation for a lot of people out there. They just stop their treatment because they say, I don't feel more energetic. I don't feel better than I was before. Why should I take this pill? Or the pill causes some sort of side effect, and it's really important for our doctors and nurses and our hospitals to discuss the issue of adhering to this medication, because unfortunately once you're diagnosed with it, it often is for life that you have to take this pill. And it is a real pain in the butt to take this pill, but it can save your life, because we talked about the numbers 120 by 80. If, for example, your blood pressure is 140 by 90, you will lose 10 years of your life. Now, the trouble is, it's not today that you lose 10 years. It's a chronic disease, so you lose 10 years slowly. So people don't appreciate that this thing is eating and is eroding your lifespan, never mind your health span. So it's really important, never mind the fact that you lose 10 years, but also the complications can arise. And, unfortunately, we're spending millions and millions of pula in hospital managing people who haven't taken their blood pressure pills, or who skip their pills, or, who stop their pills because they think they're okay, and suddenly they're in hospital with a stroke or a heart attack or a heart failure, which are the consequences we're going to be talking about in terms of hypertension. And the irony of all of this is that it's really really easy for us doctors and nurses to treat blood pressure. We have so many medicines on the market, and people don't like the word medicine, but there's lots of stuff. I mean, the first thing you need to do, having talked about this blood pressure and urbanization, is cut the things we know that occur within a city. And the commonest thing is, Botswana are addicted to what? They're addicted to salt. You can see our public reaching for the salt cellar and putting salt on their food before they even taste that food. Do you have that habit?
Yes.
Yeah, if I gave you bread that has got no salt in it, you wouldn't eat the bread. If I gave you cheese without any salt in it, cheese is delicious because of the salt in it. So unfortunately, are salt addicted, and as a result, and we know from very large studies that salt raises blood pressure. And unfortunately, on our continent, the black population is 4 times more salt sensitive than the white population. In other words, for every teaspoon of salt that you and I eat, we will raise our blood pressure 4 times more than somebody who is of white background, because our kidneys aren't able to excrete that salt as efficiently as the white population. We don't understand why, and that's why we know in the black population, in the African American population, in the Southeast Asian population, blood pressure is much higher than in the white population. So we've got to be careful about what we're eating. And unfortunately, as you know, we're beginning to eat what I call the sad diet, which is, the sad diet is.
Let's get to Botswana now. How is the blood pressure? Is it rising amongst us, Botswana?
It is rising because we're becoming increasingly urbanized, and we're talking about the SAD diet. The SAD diet stands for the Standard American Diet. We're eating more and more of the American diet, which is processed stuff. It's mafresh. It's those takeaways. I'm not going to mention them because everybody knows the big billboards that are sitting outside your office and my office. Yeah. And we're eating these things, and they're raising our pressure. We're not exercising. We're not losing weight. We're becoming more obese. The city of Johannesburg released a statistic some years back that 40% of black women in Joburg are overweight, and we're not far from that city, and we probably eat the same crappy food. So these are all issues we need to do in terms of prevention. There is a diet plan released by the American Heart Association called the DASH diet. DASH stands for Dietary Approach to Stopping Hypertension. You can just Google DASH diet, and it'll tell you all the things you need to do, which you all know, in terms of eating your more greens, in terms of cutting the salt content, in terms of taking exercise, in terms of eating more fruit and veggies, drinking lots of water, cutting your salt. But people, unfortunately, we are swallowed up by the food industry, which convinces us to eat a lot of the stuff that's out there. So that's unfortunate. So it is rising in our community. It is rising in the younger population, and we're seeing complications which are costing us in the public health sector and the private health sector enormous amounts of money. We talk about dialysis and stroke rehabilitation and heart attack rehabilitation. And when you get to that stage, you're now doing, what's the right word? You're doing damage limitation. You're not prevention. And of course, prevention is better than cure. So I really want this message to get out there that people really need to start looking. Check your blood pressure, whatever age you are. If it's normal, check it annually. If you're above a certain age or you have a family history, if mom or dad or brother or sister has blood pressure, check your blood pressure. If you are overweight, if you're eating the wrong foods, if you're not exercising, if you're sitting all day, check your pressure because you're that high-risk category, and you could actually prevent yourself from having complications in the future. The trouble is our youngsters think they can live forever. We all have went through that age where you think, I'll deal with it later. But we want to tackle this in its infancy. We want to nip it in the bud. That's hypertension in a nutshell.
All right. One question that I maybe. Okay, we get the fact that, once you have high blood pressure, you get on treatment. Is there a time where you actually can say, I'm cured? Is it there a time that you can actually say that?
Now you sound like patients of mine to say, Naka, now I'm okay, can I stop the medication? Unfortunately not. If your blood pressure is very mild, yes, with exercise and the appropriate lifestyle. I don't call it a diet because people come off and on diet. Say lifestyle change. If you continue the lifestyle change and exercise, keep your weight down, eat the right foods, your blood pressure may well be controlled. But if you have a moderate to high blood pressure, it's very unlikely that your blood pressure is ever going to be cured, and you're going to we may be able to reduce your medication, but certainly in my experience of over 40 years now, I've never had somebody completely come off blood pressure medication if their blood pressure was moderate to high. So please don't be fooled out there. Once your blood pressure is normalized And I do encourage those that can afford it to get a simple machine. It's very cheap from one of the local pharmacies, and measure your pressure on a regular basis if you have blood pressure, because it's better measured at home than in the clinic when you get anxious. And if it's under control, excellent. And then when you negotiate with your doctor, say, I'm going to continue my lifestyle measures, look up the DASH diet and make sure you know you're eating the right foods when you go shopping.
All right. Any last word, doctor?
Nothing. This is a big topic, and we're going to be continuing this for a couple of weeks. So next week we're going to talk about that dreaded one, stroke. What is a stroke? Why does it occur? Who does it occur to? How do we prevent it? Can we cure it? Is it reversible? And what is out there for us in the market in our country to prevent this deadly condition?
All right. Till next week, Saturday, please have a beautiful weekend.
Indeed. You too. See you next week.
Aye. All right. It's 10:47 on our station of choice. That was Dr. Baggard.
This segment is proudly sponsored by Zbrana Productions.